Good evening to everyone and welcome to today's session. Zakiyuddin and many more who are all across the country. There are so many ways we prepare for an entrance exam. Some are good in listening and assimilating. Some are good in writing and assimilating. Somebody are good in doing and assimilating the content. Some are good in playing quiz tournaments, and that's how they can be able to learn better. So, out of the various ways, I always find one common denominator. Whenever the learning is short, and whenever it is more proactive, whenever the learning is stimulating the mind, then the memory is longer, we enjoy the drive, etc. So that is the whole purpose of the Incus quiz app, where there are about 30,000 MCQs, organized as almost 1,500 quiz tournaments for you to keep playing. The most common MCQs which are frequently asked in the exam. So the second way to do that is through the flashcards. There's a question appearing. You will be guessing what is the answer. You're clicking on the flashcard, the answer comes. Next, if you're confident or not, you will decide. Then go to the next card, next card, next card, next card. That's how you're constantly engaging and doing the revision. So we are now creating the concept of flashcards on the learning app Incus. So I advise all of you to download the Incus quiz app. Shortly we will be adding the concept of the flashcards. So now let us take up. Good to see Anukul Chandra and many more who are all online. Keep punching your comments, your quick guess answers when I start the discussion, right? So in the case of the psychiatry, there are 1,500 very important concepts and facts we created in the form of flashcards for you to do the revision. So that is what I'm starting today. In the next 1 week, I'm going to do the revision of these 1,500 flashcards. So don't forget every day evening to 6 p.m. to log in into the YouTube channel in order to participate. Now, doctor, can the online students punch whether the voice is loud and clear? Is the voice loud and clear? Please also inform your classmates that the live class has started. Now, abhi hum shuru karenge psychiatry flashcards. In the mental status exam, typically flight of ideas. Typically those who are having mania, they have a flight of ideas. So what is a abnormality? Having abnormality, which abnormality is a flight of ideas? So flight of ideas basically is a problem of the thought process. It is a problem of thought process. Very good. So whenever you do mental status exam, you look at the appearance, behavior, the speech, the mood, affect. So what is mood? Mood is the subjective emotional state. We are depressed, we are anxious, we are sad, we are angry. That's all mood. Whereas objective emotional expression, euphoric, labile, full, constricted, flat affect, euthymic, dysphoric, they're all the expressions that discuss. objectively about the emotional expression. That is called affect. More or less affect or mood एक ही चीज होता है, फिर भी affect is an objective emotional expression, whereas the mood is a subjective emotional state, is what you need to remember. Now, thought process, thought content, perceptual disturbances. You need to know fundamentally what are the differences between the two. Thought process, circumstantiality, tangentiality, flight of ideas, looseness of association. Good to see Dr. Deepthi Birla and many more who are all online. Very good. From today onwards, we are going to restart our habit of having a discussion every day, evening, 6 p.m. Thought blocking, they're all problems of thought process. Then suicide, homicidal reaction, delusions, hyper-religiosity, preoccupations, they're all thought content, problems of thought content. It's a common MCQ in the NEET PG entrance exam. What are the problems of thought process, thought content, and perceptual disturbances, hallucination, illusions, derealization, depersonalization? They're all perceptual disturbances. That is what I want to underscore to all of you. Now comes the second question आपके सामने. Flashcard number 2. In mental status exam, shortly in about 5 to 6 days, we are going to have the mobile app. In the Incus quiz app, currently the Incus is a quiz app. We are going to convert that into Incus learning app, where we are going to create courses. One of the course will be flashcard course. 1,500 flashcards in psychiatry for you to do along with your fingertip. You can keep on swiping. Do I know this question? Do I know this question? Do I need to keep this bookmarked for the last moment revision? Totally 1,500 points go. You have to master. That is all about psychiatry preparation, right? So the moment we launch the flashcards for you to play on your smartphone and at the same time enjoy learning, bookmarking the flashcards, shortly we are going to launch it. I'll update you. So in the mental status exam, serial 7s. Similarly, if you ask the patient, spell the word backwards, what are you testing? We are all testing the attention and concentration. So whenever you are doing mental status examination, doctor, alert, sleepy, lethargic, they talk about the level of consciousness. Person, place, and date, you are testing orientation. Serial 7, that is 50, 57, 64, 71, 78, 85, 92, serial 7s. Similarly, the spell the word backward direction. They're all testing attention and concentration is what you have to be emphatically sure. Now, in mental status exam, immediate recall of 3 objects. What are you trying to test? In mental status exam, you ask immediate recall of the 3 objects. You will tell the patient, pen, ball, elephant. After a little time, I will ask you what are those 3 objects. So what are you testing in that? We are testing typically registration. Is he able to register 3 objects that you told or not? So immediate recall of 3 objects, test registration. Recall of objects after 5 minutes, test short term. Short term. And you ask about the verifiable personal information. For example, which college did you go for your school? If you say, it is called long term. Deepthi Birla was clean bowled. She thought it is short term. Short term means after 5 minutes. Immediate recall hota hai registration. बराबर? So Deepthi, अभी समझ में आ गया ना? इंकस लर्निंग ऐप के ऊपर आप जब फ्लैश कार्ड खेलेगा, आप क्या करेगा, इसको बुक मार्क करेगा ताकि लास्ट मोमेंट में और एक बार रिव्यू कर सकते. In mental exam, interpretation of the proverbs, what are you testing? So you should know, if you ask the patient about the current events, who is the Chief Minister of Telangana, that is fund of knowledge. You ask interpretation of proverbs and analogies. Proverbs and analogies, like lotus is for flower, apple is for, the patient will say fruit. That's right. That's called abstract thought. Insight, where the patient has an awareness of his or her illness and need for the treatment, that's called insight. And the patient's ability to approach his problems in an appropriate manner is called judgment. So these are the ways you do the mental examination. Now, the next flashcard. Acute onset, waxing, waning sensorium, that is worse in the night. Disorientation, come on, by now you should be ready with the answer and punch it into the chat window. Inattention, impaired cognition, disorganized thinking, altered sleep-wake cycle, perceptual disorders like hallucinations, illusions. What is your diagnosis is the favorite question of the examiner. Come on, could anybody get the diagnosis in their mind? मन में आ गया क्या diagnosis है? Flash card खेलो मुरली भरद्वाज के साथ बाबूजी. Yeah. Punch your answer, doctor. Acute onset, waxing, waning sensorium, disorientation, inattention. Excellent. Sayyada rightly answered delirium. Absolutely. It says delirium. Narcotics, benzodiazepines, anticholinergic, tricyclics, steroids, diphenhydramine, they're all etiological. If you are consuming them, which psychiatric condition the patient can land in? Tricyclics, steroids, anticholinergics, benzodiazepines, narcotics, they all can land the patient in delirium. So you should know what are the etiological factors leading to the development of the delirium is what I want to underscore to all of you. Ionized calcium. You will ask for the laboratory value of the ionized calcium. Whenever the patient is having what? Which psychiatric condition? Delirium. So how do you evaluate delirium? Look for the electrolytes, complete blood glucose, renal, LFTs, thyroid function tests, uric acid, urine toxicology, HIV, they all are the routine things. Whereas ABG, ECG, sometimes silent MI can present like delirium. Ionized calcium, it has got a medium value is what I want to underscore to all of you. Now comes the next flashcard in the game, that is mnemonics. Let me check, doctor, what are the mnemonics that you are good with? Mania. Dig fast. Come on, tell me what are all the features of mania. Dig fast is a favorite flashcard that should be there in your pocket. Type what are the features of mania into the chat window. Dig fast. What are all the components of the dig fast is the mnemonic for mania. Distractibility, irritable mood and insomnia. G for grandiosity, flight of ideas. Agitation, increase in goal-directed activity, speedy thought, speedy speech, thoughtlessness. They're all typically part of the mania is what you need to ultimately remember. What are the risk factors for suicide? There's a mnemonic for that. That is sad persons. The next flashcard for all of you. Come on, punch your comments, doctor, into the YouTube channel, into the chat window. Sad persons. What are all the risk factors that you remember for suicide? Male chance of dying of suicide are greater. Age more than 60 years. Depression. Previous attempt of suicide. Ethanol abuse. Rational thinking loss. Suicide in the family. I know there are some of the patients whose elder sister, second sister, third sister also committed suicide, and also mother committed suicide, kind of complete family. Suicide in family. If they have organized a plan how to die, that is a risk factor to really suicide. There is no support available. A lot of moral, social support is all that is required, that is missing. Any prolonged sickness, very common underlying cause why people commit suicide. They feel this life is not worth suffering this pain and end up in suicide. So these are all the things that you need to have an empathy. What are the features of depression? Size caps is a famous mnemonic. Now you are watching flashcards in psychiatry, 1500 flashcards in psychiatry. अगर आप ये 1500 मेरे साथ पढ़ाई करो psychiatry में, कोई भी आपको रुकेगा नहीं इस दुनिया में. There will be about 7 to 10 questions that come on psychiatry. 10 out of 10 मार्क के निकलेगा आप कल के नीट पीजी के एग्जाम में. Right? That is my guarantee to all of you. So, depression features: sleep, interest, guilt, low energy, low concentration, appetite, which is lost or excessive. Then the suicidal ideation, hopelessness, helplessness, worthlessness. They are considered to be the features of depression, is what you need to remember. Now comes the next deck. You know, flashcards are all like, there's a small mini topic. Under the mini topic, which we call deck, you have some cards that you can be able to play on the Incus app. Okay, so definitions in psychiatry deck के ऊपर हम अभी खेलेंगे. A man starts crying and then starts laughing without any apparent reason. What is the term for it, and where do you see that? Come on, let me see who is going to answer this. Punch your answer, doctor. A man starts crying and then starts laughing without any apparent reason. इसका term क्या है बोलो? आप कहाँ देखते हैं बोलो? So with the Incus learning app, the flashcards is a fun to play because you can ask a question to your friend, ask them to answer, then click, you will get the answer in the back. That is the beauty part of the flashcards. Very good. Ira is saying mania. Absolutely. This is called labile mode. Excessive variation in the mood without any apparent reason. It is also called emotional lability, which is typically seen in the case of the mania. Ira gets 5 Cadbury chocolates for correct answer. Now, state of excessive happiness without any reason. What is the term? Where do you see? Come on, punch your answers, doctor. State of excessive happiness without any reason. What is the term? Where do you see? Is the favorite question. It's called euphoric mode. And it is usually seen in mania or hypomania, is what you should remember. A patient would not look happy during festivals, did not appear sad when his mother died. His mood remained the same. Sthitadhi munivruhyati. In Bhagavad Gita, they say Sthitadhi munivruhyati. We should not be depressed for setbacks. We should not be hyper-elated for few achievements. The man whose mind maintains that equivalence and equanimity. Sthitadhi munivruhyati. Dhi means mind. Sthitadhi munivruhyati. But that is not really normal in psychiatry. It's called affective flattening. Irrespective of the situation, there is no change in the mood. A schizophrenic patient would not look happy during festivals and do not appear sad when his mother died. He remained the same irrespective of the situation. That's called affective flattening, which is the classical feature which is seen in schizophrenia, is what you need to remember. If a man starts laughing, looks extremely happy in a funeral, ha 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 ha, salam mar gaya ye, बोल के बोल रहे हैं तो what is that condition in psychiatry called as? Right? What is that condition? Come on, punch your answer. So, basically, appropriateness of the affect in relation to a given social situation. So, this is an example of an inappropriate affect. Telugu mein, I belong to Telugu medium in school. असंदर्भ प्रलाप बोलते हैं, जो संदर्भ को, सिचुएशन को का बराबर नहीं है, तो अगर किसी का कमेंट, इसको बोलते हैं असंदर्भ प्रलाप. इसी को साइकियाट्री में बोलते हैं इनअप्रोप्रिएट अफेक्ट, इज व्हाट यू नीड टू रिमेंबर. Appearing sad when talking about the mother's death. What do you like to call it as? Congruent or incongruent affect? Obviously, when somebody's mother died, they appear sad. That's called congruent affect. So, congruency of the mood kya hota hai? What is congruency of the mood? Always congruency, incongruency of the mood is in relation to the thought content of a person. So, whether the emotional state of the person is in sync with his thought or speech or not is called congruency. If a man is thinking about or talking about the events which led to this mother's death, he is expected to be sad. So, if he appears sad while talking about his mother's death, then it is a congruent affect. So, suppose if he says, my mother, oh my God, she was sick and had heart attack. Oh my God, she had heart attack, man. And I was taken to the hospital and she died. Oh my God. If he's laughing like that, what he's talking and his mood are not appropriate. That's called incongruent mood, is what you need to remember. Now, inability to understand the emotions of the others, inability to express the emotions of self. What is it termed as? Who is going to give me the correct answer? Psychiatry flashcards with Dr. Murali Bharadwaz. We are going to revise 1500 psychiatry flashcards from which 10 questions, 8 to 10 questions that come in the tomorrow's NEET PG. If you revise these 1500 flashcards with me, khatam. Already you will be knowing 750 to 800 flashcards out of this. Already. Another 700-800 रहता है जो मेरे साथ खेलो और उसमें से 200-300 को Incus app के ऊपर Incus quiz app. Now we call it as Incus learning app. On that you try to bookmark. And before exam, you try to do the revision. So that's how flashcard is a beautiful approach of memorizing the factual database, which is often tested in the entrance exam. Okay? And it is a self-preparation thing, The more you get an opportunity to self-prepare, the longer will be your memory. किसी का lecture सुनने में मजा नहीं है, किसी का video देखने में मजा नहीं है. मगर आपके साथी के साथ बैठ के इंकस लर्निंग ऐप के ऊपर फ्लैश कार्ड खेलो. That is a longer way of remembering things. So Dr. Deepthi is betting on alexithymia. Deepthi, you are getting 5 Cadbury chocolates. Very good. Now, what is alexithymia? Inability to understand the emotions of the others. Inability to express the emotions of oneself. Alexithymia is similar to affective flattening. But alexithymia is the lack of words to describe emotions. Not that the person is not having emotion. He has emotion, but he has an inability to express that emotion in words. That is called alexithymia. Whereas affective flattening जो होता है, emotions altogether are absent. That is called and that's called affective flattening, which is seen in schizophrenic individuals. What is the term for loss of capacity to experience the pleasure and unable to enjoy anything in the life? उसको लड्डू दे दो, enjoy, हंसता नहीं. चुम्मा दे दो, हंसता नहीं. डांस करो उसके सामने, हंसता नहीं, हंसेगा नहीं. सो किसी चीज को एंजॉय करना नहीं आ रहा है उसको. काम करने भी मजा नहीं दिखा रहे. अस्पताल जाके पेशेंट्स को देखने में भी मजा नहीं दिखा रहे. अगर कोई आदमी किसी चीज में मजे नहीं मिलता, उसको क्या बोलते हैं? That is called typically the anhedonia. The patient is unable to enjoy anything in the life is called anhedonia. Which lobe in the brain regulates the emotions? Favorite question. It is the frontal lobe. So what are the parts of the limbic system, doctor? Hippocampus, amygdala, hypothalamus, cingulate gyrus, thalamic and cortical areas related to the cingulate gyrus. That constitutes the limbic system, is what you need to remember. I am very, very happy to see 16 online classmates. Very good. You bring more number of people. We will enjoy a class every day. We will play around 100, 120 flashcards, right? And get a bit of the kick in preparation. Also, the moment flashcard is being launched on the Incus learning app, I will update you and you can start playing the flashcards, bookmark the things that you are not very sure about, and that way you can play with your friends. They also can download the Incus quiz app, Incus learning app, and they can also play the flashcards along with you. Right? Now, doctor, a man mistakes a rope for a snake in the night. What is the term for this? This is the most frequent question, doctor. अगर आप right answer करें तो psychiatry में आप एक level पहुंच गया. Now tell me, doctor, what is when a man mistakes a rope for a snake in the night? What is the term? Very good. Ritu Raj is back in action by saying illusion. Absolutely. Illusion is a false perception of a real object. For example, man mistakes a rope for a snake at night is called illusion. Absolutely. A false perception in the absence of any object at all. Or the stimulus, what is that called as? NEET PG का notification ही नहीं निकला और आदमी सोच रहा है कि उसको नहीं मिलेगा सीट. A false perception in the absence itself of any object. रोप भी नहीं है मगर स्नेक दिखाई दे रहे हैं. इसको बोलते हैं hallucination. Hallucination. It's a false perception. The absence of any object is called hallucination. Now, When a person experiences hallucination, can he be able to give a detailed description of what he is experiencing? Exactly what? Okay, the person says snake. Snake का आंखें कैसा है, कान कैसे है, नाक कैसे है. Can he be able to explain? Typically, hallucinations are vivid. That means a clear, detailed description he will be able to give, just like a true perception. That's what you need to remember. Hallucinations are vivid. Vividity is a feature of the hallucinations. Where are the hallucinations experienced? Is it in the outer objective or the inner objective space? Hallucinations are experienced in the outer objective space. What does it mean? It means the source of that perception in hallucination is in the outer world. For example, if there is auditory hallucination, he will report that the voices are coming from the wall or from outside the house, not inside his body. That is, outer objective space is the place where hallucinations are experienced. So, a patient with what kind, will report that the voices are originating within his mind and not from outside. That is inner subjective space. What is that called as? That is called as pseudo-hallucination. So, a auditory pseudo-hallucination, he will report the voice originating within his mind, not from outside. Whereas if he says from outside, then there are the true hallucination. Hallucinations can be under the willful control of the patient. Can I control the hallucinations? No. Hallucinations are not under the willful control of the patient, is what you need to remember. He cannot start hallucinating. He cannot stop hallucinating. That is the nature of hallucination. In the psychiatric disorders, what are the most common hallucinations? Come on. Murali Bharadwaz के साथ फ्लैश कार्ड्स खेलो और खेलते खेलते सब्जेक्ट का रिवीजन कर लो. इंकस लर्निंग ऐप डाउनलोड करना. So what is your answer, doc? So let me check. Shalmali is saying auditory. Absolutely. Auditory are the most common. The most common hallucination in the organic psychiatric disorders like delirium typically are all visual hallucinations, in which epilepsy hallucinations, including olfactory, tactile hallucinations, are all present. Those who are having temporal lobe epilepsy, typically medial temporal lobe sclerosis, whenever it is there, medial temporal lobe sclerosis, it is one of the surgically resectable cause of refractory seizures. In fact, there's a lot of role for the MRI to find the shrinkage of the medial lobe uncus to diagnose it. We'll discuss more in neurology. So, temporal lobe epilepsy, both olfactory, tactile, all kinds of hallucinations will be present. Tactile hallucinations, something is creeping on me, doctor. It feels like the worms, it feels like the ants, it feels like the spiders crawling on me, doc. It is an intoxication of which condition? Which substance? Cocaine intoxication, tactile hallucinations. Hallucinations occur while falling asleep or while going to the sleep. What are these? What is the term for that? And in which condition do you see? They are called hypnagogic hallucinations. जब नींद शुरू होता है तब आएगा ये hallucinations. So narcolepsy, patients with narcolepsy will show hypnagogic hallucinations is what you need to remember. hallucinations that occur while getting up from the sleep, means se jagne ke waqt pe. That is the time when hallucinations appear. What is the term used for that? Hypnopompic hallucinations is what you need to know. A patient reports that whenever he sees the rainbow, which is a visual modality stimulus, he starts hearing the voices of the God. Oh my God, the God is talking to me. That is an auditory modality hallucination. So visual modality stimulus ne auditory modality hallucination ko jagaye to, what is the term for that kind of hallucination and which substance intoxication do you see that? They are called reflex hallucinations, otherwise called synesthesias. So you want to talk to God? Oh, come on. Take a bit of LSD or cannabis, hallucinogens, LSD, cannabis, reflex hallucinations. Rainbow ko dekhe to Bhagwan dikhayega, Bhagwan ke sath baat kar sakte ho. So reflex hallucinations, cannabis and LSD intoxication. Please don't forget. A patient reported that whenever he hears the sound of the ringing school bell. What is a ringing school bell? Auditory modality. He will also start hearing the voices of the God. So stimulus भी auditory modality है, जिसके वजह से आने वाले hallucinations भी auditory है, दोनों एक ही type है. What is this term for this hallucination? They are called functional hallucinations. Functional hallucinations is what you need to remember. So what is the thought disturbance, which is primary? Thought disturbances are primary in which psychiatric disorder? कौन सा psychiatric disorder में thought का disturbances होता है? Typically schizophrenia. It is basically a disturbance of the thought is what you need to know. Now, what do you call the mental process of acquiring knowledge, which includes thoughts, but also the experiences and sensations? What is that mental process called as? It's called cognition. जब भी हम cognitive disorder कहते हैं, cognitive disorder होता है the mental process of acquiring the knowledge, which include the thoughts, experiences, sensations, is what you need to remember. I live in Montreal. My cat has a long tail. I like to smell lily. Silly, silly, silly. What is the term for this? I think I like watching this serial Crown. Crown is very good, you know. Recent Crown season 4, the one who is acting as Margaret Thatcher. Wow. She is very similar to the voice intonation of the Margaret Thatcher. So I live in Montreal. My cat has a long tail. I like to smell lily. Silly, silly, silly. What is the term for this? It's called flight of ideas. Here the thoughts follow each other very rapidly, and the connection between different thoughts appears to be by chance only. क्योंकि इनका लिली और सिल्ली और टेल और मॉन्ट्रियल के बीच में कुछ भी संबंध नहीं है. So the flight of ideas is an abnormality of the form of the thought, is what you need to remember. Derailment is an abnormality of what? It is the form of thought, content of thought, position of thought. Derailment. So you should know what is form of thought. The form is the organization of the thought, or the association between two consecutive thoughts. Normally the thoughts are well organized, and there's a connection between various components of a single thought and between the consecutive thoughts. Whereas in the formal thought disorders, there is a disturbance in this organization, association, connection between one thought and the other thought. So that is what you need to appreciate. Derailment is an abnormal form of thought. The connection between one thought and the other thought is missing. A patient said, Donald Trump was the president of America. Hey, Mumbai Indians won IPL. What is the term for this in psychiatry? भाई डोनाल्ड ट्रम्प प्रेसिडेंट ऑफ अमेरिका होने का और मुंबई इंडियंस आईपीएल जीतने का कुछ संबंध है क्या? नहीं है. तो what is the term for this in psychiatry? Come on, punctuate guessing answers, doctor. So always we need not have subject. Subject खेलते खेलते सीख लेना है, and you should enjoy spinning the flashcards, quizzing your classmates, laughing that, hey, you know, I don't know, I know, you don't know. Spardaya, Vardhathey, Vidya, right? So, 1500 flashcards in psychiatry, you're going to play on the Incus learning app shortly. And let me first do a revision of these 1500 flashcards. This is called derailment. In derailment, the association between two successive thoughts is disturbed. A patient said Donald Trump was the president of America. He was the president, true. Mumbai Indians won IPL, that is also true. But there is no link between the first thought about the Trump and the second thought about the Mumbai Indians. So that is an example of derailment. So NEET PG entrance may commonly clinical vignettes are being given. You are asked to define the clinical condition of the patient. Now, doctor, a patient says, I thought it will rain today. KCR is the current Chief Minister of Telangana. So what is the term for this in psychiatry? This is called loosening of association. The connection is lost between the components of a single thought. For example, in this example, I thought it will rain today. KCR is the current Chief Minister of Telangana. The phrase before the comma is totally disconnected from the phrase after the comma, and hence this represents a loosening of association, is what you need to remember. A patient says, Siberia, me, Statue of Liberty, pulses, football, computer, pencil, pen, etc. So what is the term for this? There's a total lack of organization. So thought is incomprehensible, does not make any sense at all. Siberia or मेरे और Statue of Liberty और pulses और football और computer के बीच में कुछ भी रिश्ता नहीं है. Muhammad Umar is asking a very good question. Derailment and loosening of association. So there are two successive thoughts. Two thoughts हैं, एक के बीच एक रिश्ता नहीं है. Single thought है, मगर there is a single thought, but it has got two phrases. पहला वाला phrase और second वाला phrase के बीच में संबंध नहीं है. So then that becomes the loosening of association. So it is like two sentences unrelated. जब भी आपको क्लिनिकल विनेट में दिखता है, then think of derailment. सिंगल सेंटेंस में कॉमा के पहला एक, कॉमा के बाद में एक, दोनों के बीच में कुछ भी संबंध नहीं है, सिंगल थॉट, then the loosening of association comes into picture. Good question. Now, a school student was asked what he wanted to pursue as a profession in life. तो उसने शुरू किया, माइक ले लिया और शुरू किया, सर मेरे क्लास 6 में I was interested in social. Maybe the social teacher is very beautiful and very close. However, in the class 7, I started liking football. क्योंकि maybe class 7 का girlfriend was appreciating and clapping when this boy is playing football. Class 8 mein, I started liking maths. But in the class 9, I realized that I have a lot of liking for Hindi also. And I was reciting poetry. हाँ, वो तो love letter लिखने के लिए तो poetry आना पड़ेगा ना. I also think that after 18, we should go to Harvard. Well, you see, I like generally aeroplanes and aeronautics as a subject and want to become a commercial pilot in life. बोल दिया, oh मेरे बाप. So, what is the term for this in psychiatry? यहाँ बहुत चीजें बताया उसने, ये भी चाहिए, वो भी चाहिए, वो भी चाहिए. But finally, did he arrive at the correct answer? That he want to become a commercial pilot. So this is called circumstantiality. So the thought process progressed with the inclusion of lots of relevant and irrelevant details. But in the end, the goal was reached because the student want to become a commercial pilot. आप कभी भी नीट यूजी एग्जाम खत्म होने के बाद उसको एक माइक देकर बोलो, I want to become a Nobel laureate in medicine. I want to help the humanity. I want to become a great researcher because I am going to all-India Institute. Blah 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 बात करेगा. उसी स्टूडेंट को सेकेंड ईयर में पूछो, oh my God, I passed anatomy. So lucky, he will say. By the time he comes to final year, if I just pass this medicine exam, which is an ocean, it's more than enough. Housemanship से मैं उनको पूछो, at least if I qualify in NEET PG, Bhagwan, I will break 100 coconuts, he will say. So ultimately, our life is also like a circumstantiality. As we keep moving from one year to another year in medical school, we start going into that decremental conduction, right? Circumstantiality. So circumstantiality में एक ही बात समझ लो, जितना भी irrelevant thoughts बताया, however the number of irrelevant thoughts, finally he will reach the goal, right? Then a person is asked, what is their absolute all-time favorite food? The person started talking. भाई आपका सबसे पसंद खाना क्या है बोल के पूछा कोई, तो उसने शुरू किया भाषण. The main being by saying how they really like apples and how that they prefer red apples to green ones. This could lead to colors, red and green, and how they are typically associated with Christmas. Hey, Rama. So commonly this is how we answer in the Viva voce in MBBS exams. Examiner बोलेगा, भैया एनाटॉमी बोले तो मालूम है क्या? हाँ, अभी सही प्रश्न पूछ रहे हो तुम. एग्जामिनर जो कुछ काटते वो है ना, उसी को एनाटॉमी बोलते. वेरी गुड, इसको डिस्टिंक्शन दे दो, एनाटॉमी पास करो बोलेगा एग्जामिनर. So इतना incoherently we keep talking in the Viva voce. It's okay, all in game. So doctor, what is this called as? This is called tangentiality. The answer is related to the question in some distant way, but the goal of the thought is never reached. So when you ask what is your favorite food, ये apples बोल रहे हैं, green वाला apples बोल रहे हैं, सब कुछ बोल रहे हैं, मगर he is not giving you the correct answer. That is called tangentiality, is what you need to remember. Adorable bruscosis, chickenaria. रोज चिकन खाए तो मलेरिया के जैसे सिम्टम्स आएगा, चिकनेरिया. They all suggest you, what are they called? This kind of words. And with psychiatric condition they are suggested. They are called neologisms. There's a new word that keep coming every time, right? So bootstrap, boot और strap के बीच में कुछ भी रिश्ता नहीं है, right? So bruscosis, adorable, etc. They're all neologisms. We use the word dish for the entire plate of food. The big house, I'm going to send you to the big house. That means it refers to prison. Tell me about your first date. I'm all ears. Ears means I'm giving you attention. So what is this an example of? This is an example of word approximations called metonyms, they're called as. Now, you asked a patient, he's replying you. What is your name? Raju. Where do you live? Raju. How many children do you have? Raju. What is the term used in psychiatry? It is not Rajosis. Okay. So what is the term in psychiatry? It's called perseveration. Perseveration. So the same response beyond the point of relevance is called perseverance, is what you need to remember. So what the person is actually thinking about, isko kya bolte hain? Is it called form of thought, content of thought, position of thought? It's called content of thought. Content of thought hota hai what the person is actually thinking about. A false, unshakable belief that cannot be explained on the basis of the person's social and cultural background. Isko kya bolte hain? Keep punching your answers, doctor. Make it a mutually productive and interesting group discussion. Very good. Ajay, Kalam, Sharma, both of them are proposing delusion. Absolutely, absolutely. Good. So, I'm so happy to see you all. Please don't forget, every day, शाम को 6 बजे को मैं 100 या 200 फ्लैश कार्ड्स लेके आपके साथ बैठ के पढ़ाई करूंगा और ये सब फ्लैश कार्ड्स को I will make it available on the Incus learning app shortly for you to do the revision, right? So delusion is that false, unshakable belief that cannot be explained on the basis of the person's social and cultural background. Delusion kiska disorder hota hai? Good to see Pushkar, Jawad and many more. Is it a problem of form of thought, content of thought, position of thought? There's a favorite question of the examiner. Delusion is a disorder of the content of thought, what actually the person is thinking. What is the most common type of delusion of all the delusions? Who is going to give me the correct answer? So, delusion of persecution. वो मेरे पीछे पड़ रहा है, पुलिस वाले मेरे पीछे पड़ रहे हैं, मुझे मारने को कोशिश कर रहे हैं. So this delusion of persecution जो होता है, it is the most common type of delusion. A patient claims FBI along with Russian spies are hatching a conspiracy to kill him. It's an example of delusion of persecution, is what you need to remember. A patient claims that the clock in his room is clicking, tick, 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 tick. Oh, maybe there is a time bomb inside that clock. So what is an example of? It's an example of delusion of reference. If the patient believes that the events which are happening around him are somehow related to him. A lot of times when we don't get the seat, when we go back to the reading room, we will be thinking everybody is watching me only. Everybody is knowing that I am not qualified in NEET PG. But nobody has time to think about us. Everyone want to think about themselves or something which may appeal to themselves, not about your NEET PG performance. NEET PG में जीता या हारा आपका नसीब है. So that's what you should realize. So that is the reason, doctor, I always say, don't plan 9 months, 10 months of preparation and about 1,000, 2,000 hours of preparation. वो सब बकवास है. कोई टॉपर बोला तो खाली झूठ बोल रहा है. Hardly you don't need more than 500 hours of preparation, doctor. Let me tell you. आपके पास exactly what is the material you need to nail down. आपके हाथ में रहना है पहला. That is very important. So, with almost 20 years experience tuning mentoring, training almost 2 lakh medical students across the world, I understood only one thing. Those who are toppers are focused, hyper-focused. They know what to read, what to ignore, what to mug, what to logically understand. So I invite all of you. We have devised 428 hours of, 427 hours of video lectures, totally 1600 video lectures covering all 19 subjects on the online-MABS.com. So shortly we are bringing that as a course on the Incus learning app also. It is all that you need to become a topper in entrance exam. And more or less every day we keep discussing the flashcards on the YouTube channel, free for everybody, to stimulate your preparation. So please don't forget to call our helpline and subscribe to the online-MABS.com 2022 high density video edition, right? So that gives you around 427 hours of video lectures, revising all the 19 subjects. So now, doctor, delusion of reference, events happening around him, the patient thinks somehow related to him. A patient claims that he is the reincarnation of Sai Baba and that he can convert the sand into gold. What is it an example of? It is called delusion of grandeur. He has a exceptional identity, exceptional power. It's called delusion of grandeur. A auto driver is claiming that, hey, Priyanka Chopra is in love with him. And you ask, bhai, Priyanka Chopra agar tumse mohabbat hai to when did you meet her? Oh, मैं तो movies में मिला उनको, movie देखा उनका, उनसे कभी नहीं मिला, मगर I know that Priyanka Chopra is in love. So what is that called as? That's called delusion of love. Erotomania, fantasy lover. So patient has a false belief that somebody is in love with him. It is also called de Clermont syndrome, is what you need to remember. The patient denies the existence of his body, their mind, or the world in general. They may claim that everybody is dead, the world has stopped. It is an example of which delusion? It's called nihilistic delusion. World is ending, NEET PG is no more there. COVID is going to eat all of us and we are going to die like piles of ants. What is that called? Nihilistic delusion. So, it is also called Cotard syndrome. Cotard syndrome is what you need to remember. The patient has a false belief that his partner or spouse is having an affair. False belief, unshakable false belief. It is an example of, it's called delusion of infidelity, delusion of jealousy, which is also called Othello's syndrome. Othello's syndrome is what you need to remember. Where do you see delusion of guilt? Usually it is seen in severe depression. Whenever there is a severe depression, we see the delusion of guilt. If a patient says aliens have stolen his brain, aliens, Mars, Jupiter से निकल के आके उनका दिमाग को लेके गया, it is an example of bizarre delusion. Whenever person's delusion is scientifically impossible, culturally implausible, what is an example of? That is called bizarre delusion. If a patient develops a delusion that his elder brother wants to take away his property, मेरा पूरा जायदाद लूटने का कोशिश करना है मेरे बड़े भाई, हो सकता क्या? क्यों नहीं हो सकता? There are many बड़े भाई और छोटे भाई जो एक दूसरे का जायदाद छीन लिया. So it is not true, it is a delusion, but it is possible. So it is an example of a non-bizarre delusion, is what you need to remember. Obsession, what is it? Obsession is a disorder of the possession of thought. Normally, one experiences that their thoughts belong to themselves. No one else can influence their thinking process. They feel that there is a sense of control on their thoughts. So that is called as the possession of thought. So obsession is such a disorder of possession of thought. The thought comes repeatedly into the mind of the patient against his will. And the patient recognizes that his thought is his own thought, but he is depressed by the repetitive, intrusive nature of the thought. So what is that basically called as? That's called as obsession. Obsession. For example, किसी ने सोचा कि भाई मैं साइकियाट्री पढ़ाई किया मगर साइकियाट्री काफी पढ़ाई नहीं किया. जब भी साइकियाट्री का क्वेश्चन दिखता है, whenever I see the psychiatry question, I keep thinking, oh my God, I have not read the psychiatry well. Oh my God, this is a psychiatric question. I have to answer this question. Oh my God, that is obsession. Obsession. The patient continuously blames his poor memory on the government agents, and he says that they are able to steal his thoughts. Hey, invention, COVID का वैक्सीन कैसे बनाना मुझे ऑलरेडी मालूम है यार, ये फाइजर वालों ने मुझसे छीन लिया उसको. He says that the other people can hear clearly his thoughts inside the mind. What is the term for this? That's called thought withdrawal. So you should know thought insertion, thought withdrawal, thought broadcast. ये तीन चीजें डेफिनेशन क्या होता है गर्मा गर्म आपको मालूम होना पड़ेगा. Thought insertion. Patient feels that some external agency is inserting a foreign thought into their mind. इनका नहीं है, ये विचार मेरा नहीं है, किसी और ने इस विचार को मेरे मन में घुसाने की कोशिश कर रहे. Somebody else is trying to push the foreign thought which is not native for me into my mind. That is thought insertion. Thought withdrawal. Patient experiences that his thoughts are being withdrawn from their mind by external agency. Thought broadcast. Patient experiences that the thoughts are escaping from their mind and other people are able to access them, just like a hacker accessing the server. That's called thought broadcast. So that is the flashcards with Dr. Murali Bharadwaz. Today evening, doctor. Don't forget, download Incus Quiz app from the Google Play Store. Every day evening, 6 p.m., log into our YouTube channel with Dr. Murali Bharadwaz and 1-2 घंटे हम चाय पे चर्चा खत्म करेंगे. And don't forget, online mbbs.com में आपके लिए 2022 high density video of 427 hours of video lectures, nearly around 1560 video lectures covering all 19 subjects, along with PowerPoint slides of notes, is being offered. So don't forget to call our helpline 9000-868-356 to subscribe today only for the online mbbs.com video library 2022 edition, right? So thank you so much, and we will once more meet tomorrow at 6 p.m. with flashcards in psychiatry with Dr. Murali Bharadwaz. Thank you.